At MPHA, we start all of our events and meetings with our ancestral land statement, which was developed with our Health Equity Committee in partnership with many people. So I will read that for us, and this is available on our website as well. We ask that you take a moment to honor and acknowledge that we are on the ancestral homelands of the Dakota and Anishinaabe. Indigenous people have a long-standing history and connection to the land since time immemorial and are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and U.S. governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors, and descendants, as well as the land itself. And with that, I have the great honor of introducing Marie Hampton. Marie provides digital well-being expertise and guidance for public health, youth development, and mental health organizations and professionals. During the last 4 years, she has been an active contributor to an online harms prevention national work group hosted by Fair Play, which is a national nonprofit dedicated to helping children thrive in an increasingly screen-obsessed culture. She also has been a member of their Nature and Play work group and was a founder of Live More, Screen Less. I've known Marie for a long time, and I'm very happy to have her here. If you attended our policy forum earlier in the year that was focused on young people and myth busting, Marie was a panelist. At that time provided some information about this topic. So this is kind of a part 2 of that conversation. And with that, I will turn it over to you, Marie.
Great. Thank you, Ellen. Really happy to be here. I do have a slide deck, which I will be sharing with you all. And I really tried to keep it to about 35 to 40 minutes with the idea that we'll have 20 minutes at the end to have Q&A and just discussion time. And if for some reason we don't get to all of your questions, or you feel like you want to have more opportunity for conversation, please reach out to me. This is an area that is such a passion of mine, and I'd be happy to have conversations following this hour that we have together. So don't hesitate to reach out. So I'll go ahead and share my screen, and we'll get started. And just know too that speaking of technology, I don't have the greatest setup today. I have some notes. I don't have a lot of notes, but I do have some notes that I'll be looking at now and then along the side here with my iPad. So I'm using 2 screens today, and I'm not super adept at that. But anyway, just welcome. We're coming here today to focus on a book that was released in March that has just caused I believe, a tidal wave of conversation and discussion around the impact that screen use is having on young people and on children. So Jonathan Haidt is the author of the book, and I will be referring to it, of course, throughout the presentation, but I'm also going to bring in some other information to us. I want to thank let's see, there we go. I want to thank the Minnesota Public Health Association for not only hosting this, but just all of the work that you do as an association to bring to attention the public health issues of our day, and your focus on health equity, and your thoughtful work towards policy, education, all of it. Just really appreciate being a member of this very dynamic and active Minnesota Public Health Association. And Ellen introduced me, and I'll just share a little bit more. I don't know, whenever I go to webinar, I'm like, who is this person? Where are they coming from? What's their background? How does it influence what it is they're sharing with us today? So Ellen already shared most of the information. I have some visuals here. I am really passionate about the health and well-being of young people and have been for the bulk of my career. I started my career as a health educator, and I feel like I've come full circle. I spent some time in higher education, but always with college students working with young people. I was on the Annex Teen Clinic board. I taught at a tribal college. When all the work that I've done at the University of Minnesota Boynton Health Service, I have always been energized, inspired, and engaged with young people. And in this work, I am as well. I want to say also that I have no conflicts of interest. In other words, I don't have any connections to technology companies in any way, shape, or form that would influence what I am about to share with you today. I do not benefit from any support from any tech companies. So just want to put that front and center. And so I did create a consulting practice called Digital Wellbeing Solutions. And my work is really to support you all in the room here, in the virtual room, and others to equip and educate and inform and guide how we might, as a community, support the well-being of our children and young people as they spend time online. I don't know. It seems like it's almost every day I wake up to news related to the issue. And today was no different. So, on the front page of the Washington Post today, cell phone bans are spread in schools amid the growing mental health worries. Maybe you've heard that LA, the school district in Los Angeles, they're banning cell phones during the day. And it sounds like New York might do the same. And then, of course, across the country, there are multiple school districts. I just learned that Vermont is another one where schools are really taking this issue of attention fragmentation seriously and looking for ways to limit distraction during the school day by the cell phone policies. And then, we're focused on mental health today, but I am so concerned about all the advertising that is geared towards our children with unhealthy products. So here's an example this morning on the email that I get from the team at Screenagers, and it's how Zen's social media strategy is driving teen nicotine addiction. So just another concern around just social media and all the advertising that happens, unhealthy advertising that happens. But today, we're going to focus on the anxious generation around the 4 foundational harms in the context of other events. And I really want to sort of set the stage and do the kind of lay of the land. And this book emerged amidst other really big events nationally, just to become aware of the action steps that are recommended in Jonathan Haidt's book, and to consider a public health approach. And many of you are coming from public health and understand these approaches as comprehensive ways to address complex issues. And then I would really love for you to just consider one step that you might take as a result of what you hear today. So just to provide some context, I wanted to share just a series of events over the last 5 years. So I've been involved in this work since 2019, focused specifically on advocating for digital well-being for and with young people. And when the social dilemma hit the screens, this was a big event in raising awareness nationally. The dilemma was that never before have a handful of tech designers had such control over the way billions of us think, act, and live our lives. And Tristan Harris, former Google ethicist who started the Center for Humane Technology, who is featured in the film, summed it up this way with a warning: if you're not paying for the product, you are the product. And Jonathan Haidt is also interviewed in this film. Then in September 2021, the Wall Street Journal began publishing articles about Facebook, some files from the company that were being shared by a whistleblower. These leaked documents revealed that Facebook had been studying the impact of Instagram on young people, and they were concealing it from the public. So finally, on October 2021, the former Facebook employee, Frances Haugen, came forward as a whistleblower. We've had another whistleblower from Facebook called, his name is Arturo Bahar. He has also come forth to say that Facebook is well aware, now Meta, of the harms it's causing, and they're not investing in any ways to protect our young people, in serious ways of protecting our young people. And then we have our Surgeon General. So Dr. Vivek Murthy, in December 2021, he released an advisory, and advisories are used for significant public health challenges that demand American people's immediate attention. So the first one was on protecting youth mental health. And within this, of course, I want to say that there are multiple factors, of course, that influence the well-being, the mental well-being, the mental health of young people, just as is true for adults. So there's multiple contributing factors. This advisory brought light to those, one of which was technology. So it was really an advisory to say, we need to pay attention to these rising trends. We see them in Minnesota too. The rising trends of anxiety, depression, suicide ideation among Minnesotans. And we have to respond, and we have to do what we can to reverse those trends. And then in May of 2023, early in the month, Dr. Vivek Murthy had written a book also on loneliness and isolation. This was a public health advisory bringing attention to how lonely we are, with, again, technology as a contributing factor, and pointing specifically at time spent alone when we're not in community with one another, and how might we be in community with one another to decrease those trends of loneliness and isolation. Then at the end of May 2023, we had a report specifically around social media and youth mental health from our Surgeon General. And basically is stating that we cannot at this point conclude that social media is sufficiently safe for children and adolescents. We just can't yet. Science is emerging, research is emerging. But while we can't do that yet, we need to take steps to mitigate those risks, because children are being harmed from these products. Which gets me to my next slide, which is the Kids Online Safety Act. So this was brought up. I'm not sure why that green line is there. I apologize for that. This came about in February 2022. It was bipartisan legislation. Essentially, it was introduced to protect online safety of children. Right now, we have very little to no guardrails on social media platforms, on the internet in general. This was led by a bipartisan efforts by Senators Blumenthal and Blackburn, and many senators, including ours in Minnesota, have signed on to support this legislation. The organization Fair Play, which is based out in Boston, is an advocacy organization. Ellen mentioned that at the beginning, these work groups that I sit upon. They became very involved with advocating for the Kids Online Safety Act, and specifically a group of parents who have tragically lost their children to online harms, make up about half of the work group that I sit on, called the Online Harms Prevention Work Group. And they have formed a specific group of parents who have lost children to online harms called Parents SOS. So Parents for Safe Online Spaces. And there have been incredible advocates. And I just have to say thank you to all that they have done out of their pain. This was mentioned in, COSA was mentioned in Biden's, President Biden's State of the Union speech in 2023 too. So you can see that it's at the federal level, this legislation, and it's also impacting our president, who's become aware of these online harms and how it's impacting families. And then maybe you saw this moment. It was quite dramatic. So for the COSA advocacy that's happened over several years, couple years, one poignant moment, January 31st of this year, that the tech executives were called to come before Congress and respond to inquiries and questions. And one senator asked Mark Zuckerberg to turn around and to face those parents. These are the parents and the Parents SOS group, and apologize them for the product, which young people are using. It's causing them much harm, and some children are dying from it, either from dying by suicide because they've been the victims of extreme cyberbullying, they've accessed drugs that are laced with fentanyl, or they've participated in online challenges like a choking challenge. So this was quite a dramatic moment. And then we have the release of The Anxious Generation in March of this year. And this is a New York Times review of the book. Essentially, Jonathan Haidt coming forth to say we're failing our children and taking a firm stand against tech. And I just want to say that with Jonathan Haidt's book, he has created a community of people. He's really trying to create a movement, and anyone can join it. Anyone can join the movement, can sign up, can look at the resources on the website, can engage in conversation about the research. He's opened up a Google Drive for people to participate. And so he's taken a strong stance, and he's open to both improvements, criticism, and opportunities to partner. And then we had, just in June, our Surgeon General came forth to say we need a warning label. And again, it's because of the mental health crisis among young people. He's calling it an emergency. And he's saying that social media is an important contributor, especially for those adolescents who are spending more than 3 hours a day on social media. They face an increased risk of depression and anxiety. So as the amount of time spent on screens is slowly rising, or we need to attend to this. And this is one mechanism, definitely a public health intervention to call attention to the harms. And so he's really calling that we take this seriously. There is an article recently of an interview with him that's reported in Lancet. So I encourage you to take a look at that too, just about this issue of opportunity, I would say, to have a warning label. And then just want to circle back to COSA, a very exciting time at the end of July. I want to thank Fair Play, the organization that is really organizing advocates in support of Kids Online Safety Act, and absolutely want to share that the parents, I don't think this legislation would have passed without their advocacy. So again, they've channeled their grief into advocacy on behalf of the children that they lost. And amazing response by the Senate. We now need to focus on the House. So we now need to pressure the members of the House to support the Kids Online Safety Act so we can get this passed and we can make the internet and online experiences safer for our children and young people. To just also understand just use. Okay, so what does it look like now? I think the Pew Research reports, which Jonathan Haidt, he references throughout. He also uses a couple other sources for national surveys of young people. I'm just going to feature a few just to give a snapshot. So now, nearly all teens in the US have access to a smartphone, 95%. And you can see on the second graph there, the share of teens who say they are online almost constantly, that this has roughly doubled since 2014 and 2015. So something to really attend to, the time spent. We know that Black Hispanic teens are more likely than white teens to say they're online almost constantly. And teen girls are far more likely than boys to say they use TikTok almost constantly. So these are very addictive forms of apps. And lastly, from Pew, nearly 1 in 5 teens say they're on YouTube, TikTok, almost constantly. So these are teens ages 13 to 17. think there were about 1,400 teens that were surveyed. So just something to consider. And I know Jonathan Haidt in the book also talks about stats related to use, time spent. So Haidt's exploration of this issue highlights two key elements, and he's calling it the rewiring of childhood. So the childhood that I experienced, and perhaps some of you, we didn't have access to a phone in our pockets. And so our childhood was much different from the childhood today. So there's been a decline of the play-based childhood, and there's been a rise of the phone-based childhood. And this is funny, but not funny. So 2 cartoons here. Thanks to smartphones, we don't need to buy him too many toys. And then he texted his first word today. So all to say, and we all know just by looking around, we know that childhood has changed because of technology. We see it when we go to restaurants, when we go to, public spaces, even when we go to parks, it has changed. And of course, we know there are benefits and many, many advantages to technology. We listen to music and podcasts. We work remotely. You're joining me here today because of technology. We can organize around civic engagement. There's incredible tools. That's indisputable. But the downsides we must address because we know that tech overuse and misuse can be harmful to our children and young people. We know that to be true. What are we going to do about it? This quote from Dr. Richard Freed, I came across it when I got into this work in 2019, and I think I have it in almost every presentation because I believe it just kind of helps to understand that our children's time spent on technology, that's not the only problem. It's the experiences that are fundamental to healthy childhood development that are being replaced by the overuse of technology. So we talk about this idea of displacement. And it is to consider, what do we know about healthy child development, healthy youth development, and is technology getting in the way of what we know to be good and true around child development and healthy youth development? Really exciting to know that there's a longitudinal study that's taking place in multiple sites across the nation. The University of Minnesota is one of those sites. It's a longitudinal study that started around 2015, 2016, and will go for 10 years. I think it's going to be even extended beyond that, where they're following over 10,000 children. They entered the study at age 9, and they're doing brain imaging and doing assessments and multiple ways to monitor their health and look at specific risk factors. Of those, they're including time spent on screen. So we will know more. And this ABCD study, they're really great. I encourage you to go to the website because they're really good about releasing data as they learn it and getting that out to the public. According to Jonathan Haidt, we're overprotecting children in the real world. So I'm not as focused on this during this presentation, but this whole idea is that we become overprotective of our children. We're not allowing them to play as freely as children have been for most of the duration of human life. And they need that time, right? They need that real world experience to learn all kinds of skill sets. So we're overprotecting children. And I'm a part of that parenting generation. As I read this book, it was a little hard because I could see myself in that. And we're underprotecting them online, where many children are being severely harmed, especially during their vulnerable years of early puberty. So this focus on age, on puberty, I think is really critically important as we think about a public health perspective on this issue. So I'm just briefly going to go through the four harms. And then I want to get to the collective actions as well. So social deprivation, you can see the downward trend here. Since 2012, the time adolescents have spent with friends in face-to-face settings has dropped by about 50%. The pandemic, of course, that made it worse. And humans, you know what? We're made to be in community with one another, and when we're not, we suffer. And so just pretty dramatic to see this time spent. And I had lots of conversation with my friends as my two boys were growing up and had that same experience. Then there's the sleep deprivation. So interference of sleep caused by devices. This is very well documented from device use before bed or checking notifications throughout the night. Children are getting fewer hours of sleep. They're resulting in mental, physical, and attention issues. Even K through second grade teachers. So in one school district, teachers of the younger elementary age children said that children are arriving to school sleepy because they've been spending time on screens late into the night. Another example in a focus group, it wasn't really a focus group, it was just spending time with 12-year-old girls. When I asked them, how many of you use your phone as an alarm clock? 11 of the 12 raised their hands. How many of you are checking your phones between the time you go to bed to the time that you wake up? And 10 of the 12 raised their hands. So children are waking up through the night and they're on their screens, which of course makes it really hard to get good quality sleep. So huge issue, especially as it relates to mental health. So there was a study called The Brain Drain, Adrian Ward at the University of Chicago, who did a study where he had college students in 3 different groups. One where college students had their phones face up on their desks as they were doing these cognitive tests. Another group had them in their backpack, had the phone in the backpack, and another group had the phone in the hallway in their backpack. And then after doing these cognitive capacity assessments and tests, the ones who performed the best were the ones whose phones were out in the hallway. So a study that just has really gotten a lot of attention to say, and other studies have replicated, just having this phone near me, if I'm out for dinner and the phone is in view, it's drawing my cognitive capacity. I'm wondering what emails I'm getting. I'm wondering, what's happening, and I'm not giving my full attention to the people that I am with. So not just affecting young people, it affects adults as well. So our attention with the notifications and constant interruptions, our attention is fragmented, and it's really hard to get back on tasks when that happens. And on a positive note, I will say young people are really trying to do all that they can to reduce the distractions they're experiencing when they need to attend to homework and other tasks. They're trying, but it's really hard because of this issue. So the fourth harm is addiction. And Tristan Harris from the Center for Humane Tech coined the term slot machine, or phrase slot machine in our pockets. So the slot machine is the most addictive form of gambling, and our phones have similar features. And it was Sean Parker, the first president of Facebook, in a 2017 interview said that the creators of Facebook, this is what they said: how do we consume as much of your time and conscious attention as possible? And he explained the social validation loop by which these companies exploit our vulnerabilities in human psychology. The apps need to give you a little bit of dopamine hit every time you like or you comment, and that will get you to contribute more content. So he said Mark Zuckerberg and the co-founder of Instagram understood this, and they did it anyway. And the quote that is quite well known among people who do work in trying to, prevent online harms is that Sean Parker said, "God only knows what it is doing to our children's brains." Tristan Harris called it the race to the bottom of the brainstem. So this attention economy that we're living in, this is the world we are all living in. And we know attention is a limited resource. There are so many waking hours in a day. There are only so many things we can focus on. Technology is making this deeply complicated because we just have this information at our fingertips. And we have so many demands on our attention. And I want you to think of what that's like if your frontal cortex is not fully developed, if you're in puberty or if you're a young teenager, or even a young adult. So there's this feeling of constant distraction. Um, and it's good for the tech companies, right? They're making money because they sell it to advertisers. So that's our attention economy that we're living in. When we think about a public health approach to this issue, it's a complex issue, right? With we're all tethered to our devices. We're all using technology for really good purposes, and we're all recognizing that there are some harms. It's complex. So I think I get hopeful when I think about a public health model to approach this issue of online safety. So in general, public health models, they do a great job of comprehensively addressing health or social problems. They consider human factors, characteristics of harm, the source of harm, and the environment. And when I talk about environment, it's a very broad sense of the environment, the physical environment, the cultural environment, the social environment. And with models, they identify the causes, and it's a really great way to then suggest possible interventions. We can learn from past public health successes and pull them into this arena. And it takes a population approach, which is critical. And so here's a model that I really think fits well with this issue. In fact, I attended a conference in Portland, Oregon this summer, and I shared this model as a way to think about all these levels, these spheres of influence. So essentially with the socio-ecological model, it is attending to the environment, and it is attending to the various levels, including the individual, which is our knowledge and attitudes, our skills and behaviors, and then the larger sphere of interacting with our friends, family, and our social networks, looking at institutional environments like schools and workplaces, and then looking more broadly at our cities, our neighborhoods, the resources that we have, the cultural norms that we have, and then the largest sphere being the policy, so our federal, state, and local legislation. What I like very much about this model is that we can see ourselves in it. This is a complex issue. There's multiple strategies that can be used to address it, and it's not falling on anyone's shoulders. It's all of us need to be engaged on various levels of influence to prevent online harms from happening to our children and our young people. So just think about this as I move to the next set of slides that have to deal with the collective action that Jonathan Haidt is calling for. I just wanted to share his mission statement. Jonathan Haidt, and Zachary Roush is his research partner. The mission statement is to motivate and empower teens, parents, educators, policymakers, and the tech industry leaders to act collectively to free children and adolescents from a childhood spent largely alone on screens, and instead promote independence, free play, and responsibility in the real world. And he essentially says that this collective action problem requires a collective response. And these are some examples. So there's voluntary coordination. There's an organization called Wait Until 8th. It's a group of parents that got together that combed the research and has what parents need to really reinforce the idea of not granting a smartphone to children until 8th. And Jonathan Haidt thinks it should be 9th, but that's, it's both are good. And then to attend to the social norms. So this idea that we are overprotecting our children, we're not allowing them to roam freely. And I want to say that not all children have the liberty or the opportunity to because of the neighborhoods in which they're living. But how might we carve out opportunities for children to kind of be out on their own and develop agency and resilience and skills around that? So it's seeing that as normal. A technological solution, so things like better basic phones, lockable pouches, age verification, so all kinds of technological solutions that could be brought to bear on this issue. And then, of course, laws and rules. So mention COSA, mention school cell phone policies, and the like. And this image is from Wait Until 8th. So I'm just going to highlight two areas of action for each category in Jonathan Haidt's book. So it's what governments can do, what schools can do, what tech companies can do, what parents can do. So what governments can do now, I would say, like, let's just pass COSA. It sets a duty of care. So the defaults about privacy are set to the highest standards, and it does a number of different transparency, enforcement. So we need this. Again, when I talk about the internet and I talk about young people on the internet, it's like the Wild West. There's no guardrails right now. We need significant change, and COSA could do that. So again, contact your House member if this is something that's important to you. And then on the state and local government level, really should encourage phone-free schools and more free play and recess in schools. So these are two recommendations in The Anxious Generation. Two recommendations from what tech companies can do. So it's developing better age verification, because parents should have a way of identifying their child's devices as belonging to a minor. And then make design changes to their products. So just removing that harmful content, removing that dangerous content that is fed to our young people through algorithms, and be transparent and clear about what they are doing. I believe Minnesota has a new law around transparency that was led by Representative Zach Stevenson. I just know a little bit about that from a conversation with the Assistant Attorney General last week. So states can really take some action to really hold tech companies accountable. So we can do that on the national level. We can do that on the state level. What schools can do now, go phone free for the entire school day by using these lockable pouches or lockers, and give more playtime with better playgrounds to K-8 children. So schools can do that right now. And I'll mention some resources for that toward the end. What parents can do right now is really just maximize in-person activity as much as you can. I know this issue of managing technology, no other generation of parents has had to do this before. I feel like the burden of this issue has been resting on the shoulders of parents and on young people, of course. So anyway, we can delay giving child a smartphone, connect with other parents that want to do the same. Sometimes we sit in isolation. We don't want our child to be the only one. But if we band together with other parents, maybe there could be a collective response to delay the onset of use of smartphones, and protect sleep, removing devices from bedrooms. So these are just a sampling of some of the recommendations. These 4 recommendations from Jonathan Haidt, they've gotten a lot of attention, some pushback, but here they are. No smartphones before high school, so waiting until around age 14 or 9th grade. No social media before age 16, just really trying to protect that vulnerable child and youth development period during puberty. It's really been harmful for girls in particular with social comparison and the algorithms that end up harmful ones targeting both boys and girls. Phone-free schools, talked about that. Just let's let our children learn. And I've not said anything about teachers. So early on in this work in 2019, the first survey that I conducted was with teachers. And this issue of trying to compete with a phone in the classroom is demoralizing. Teachers are leaving the profession because it's just so challenging to try and teach while phones are available and readily accessible by their students. So we need to protect the learning time of children and young people while they're in school. More independence and free play, generally just providing those opportunities that we know to be true for healthy child development. And so just looking at my time here, I'm going to wrap this up. So just revisiting this socio-ecological model again to think about like what was just discussed. And here I wanted to provide some examples of what's happening to address and prevent online harm. So just a smattering. And these are all happening here in Minnesota. So there's a group, the Brooklyn Alliance for Youth received a grant from the Minnesota Department of Health to bring Black youth together. It's a 3-year project. Last year, they brought together 200 Black youth to focus on Black joy, which is really wonderful, and to focus on what concerns and issues around mental health are the young people interested in focusing on? Well, they're interested in focusing on policy solutions to social media. So I'll be going to the group's second summit on Friday to do a workshop with young people who are interested in getting involved on the policy level. And then we have a Minnesota Attorney General who has been collecting stories of online harms from Minnesotans throughout the state. They put a report together. They put some educational materials together. This was mandated to them by the legislature. They're working on a second report. And it was interesting just having the conversation with the assistant last week. He said, please tell the youth that you're going to be seeing on Friday that we want to hear from them. We want to hear their policy recommendations. And then Representative Feist passed, together with Representative Robbins, bipartisan, passed a bill that would require the Minnesota School Board Association to develop model cell phone policy. So that's happening right now in Minnesota. And this summer, the University of Minnesota focused on this issue of well-being in the digital age at their annual Summer Institute. So we have some exciting things going on here in Minnesota. And there are more, but again, just a smattering. And here's some events that have happened nationally. I mentioned the phone-free movement earlier, that I would alert you to a resource. There's a phenomenal resource. It's the Phone-Free Schools Administrator Toolkit. I will follow up with Ellen and Mary with a list of resources. There's someone who's running marathons across the country to bring attention to this issue. He himself was harmed on the first day of a job. They found a post that he had made during his teenage years, and he was let go. And so he is now traveling across the country, talking to young people, talking to parents, bringing attention to the issue. And he has the list of all the names of parents who have lost children due to online harms. He has that wrapped around the bus that is following him. So just an individual, which is just amazing, doing this important work. Some legislation has passed in Indiana that's going to ask schools to bring digital literacy into the classroom, and that is Joanne Bogart, who lost her son Mason. NextGen is a program that brings adult and youth advocates for online safety together to work on projects. So that's really exciting. The youth voice is critical to this work. Youth, not just youth voice, youth engagement and youth solution making. And then another online harms prevention work group member, Kristen Bride, lost her son Carson to extreme cyberbullying. She's been very involved in trying to get the anonymous apps removed. And so now families can sue the app developer. That just happened. So exciting things happening. And I will wrap up real quickly. I don't think we necessarily need to go with these. I'll provide the slides. You can read. These are just important suggestions from Jonathan Haidt for parents specifically, and let's have some time for Q&A. And I will please, if you would take 3 minutes to complete the evaluation, toward the end of our time together, that would be great. I think Mary and Ellen have access to the link and the QR code. But I will turn it back to Ellen because I think she's been collecting any questions, and I will stop the share here. And we'll make
Yeah.
that link available to you.
Yes, I put it in the chat. Do the survey, folks. There's a couple questions or comments that have come in the chat. And if you've been waiting for the end, folks, now's the time. Feel free to put in the chat. One question is about approaches to supporting young people or maybe older folks in reducing their active phone use. For young people especially, how do we support reducing phone use while maintaining a relationship? So how do you, support someone in that in a way that's not, extremely punitive or restrictive?
Excellent question. So there's some incredible conversation guides, and I will share those in the list of resources to help caregivers or parents have conversations with their young people about this in ways that are open with curiosity. And So I think that's really important. Just as we do with sexual health conversations, we can do the same with this issue where it's not a one-time conversation, it's ongoing. It's rooted in the values that you have as a family. It's opening up the conversation with curiosity and not judging. And then if your child brings up something that's very alarming to you, please try to remain as calm as possible. There are so many resources available to help in situations where a child is being cyberbullied or where a child has been approached by a stranger, all kinds of resources. So it is just, again, getting back to having conversations, asking curious questions, and being non-judgmental. I will share with you that in all the focus groups that I've had with young people, they are eager to talk about this issue. It is especially true when they're in community with other young people, because once young people start sharing their experiences, they feel like they're not in the isolation, that others have a similar experience, and they're also then sharing what they're doing about it. So I would love to see a series of conversations with young people throughout Minnesota around this issue, just providing young people with the opportunity to talk about an issue that's so pervasive and ever present in their lives.
Thank you. The next question was if you have any resources or research about the effects of smartwatches or similar devices.
Oh, so interesting, specifically about smartwatches. I honestly don't. I've never had that question before. That's so great. I have a ton of resources on the impact of just getting notifications, getting constant interruptions, how that impacts attention, the algorithms, and how those target young people if they're like, anyway, lots of resources around the issues related to constant interruptions, which can happen if you have a smartwatch.
Mm-hmm. Yeah. All right. Are you aware of data around children whose parents have significant phone usage, even if the child has limited access?
Yes. Yes. So, of course, like children are watching us all the time, and parents have an incredible opportunity to model the behavior around their own phone use. Many young people shared with us, my mom or my dad, their phone use is worse than mine or more excessive than mine. So it is really a lot of times when I'm doing workshops with adults who are advocates of young people, it is to start with digital well-being for you. So how is this technology impacting you as an adult and as in whatever role you have as auntie or uncle or mom or dad or guardian, and what is that communicating to my children and to
Mm,
the young people around me? Super important.
yeah.
It's like we have such a profound impact on our children, those of us who have children as parents. And so just really I suggest you start there. And there's some great resources which I can also share, digital flourishing assessment, and some books that I think are just really great to kind of um, there's one called How to Break Up with Your Phone, which is very humorous, but it also just encouraged you to like remove the apps that are maybe not fueling you, like removing a lot of your apps and then only bringing the apps back that add value, essentially. So it's to reassess the apps that we have and what do we have on our home screen. Um, and I would say be open with your child that this is a struggle. I struggle with this. What are you doing? This is what I'm trying to do. And I think also that helps young people say, oh, wow, my parents are really struggling too. Like they see it, but to verbalize it and to say why it is, I think can be very affirming and powerful.
Yeah. And probably with kids of all ages, right?
Yes.
Like you have a 1-year-old, they're still noticing if you're on your phone a lot,
Yes.
you know, and learning what that means about being in the world and attention and communication and stuff.
That screen is so captivating, right? It's yeah. I
Yeah.
have so many stories I'd love to share that I've had conversations with parents, but that'll be for another time.
So, Erica in the chat just asked, relatedly, how do you introduce technology in a healthy way to young kids?
In a healthy way with kids, I would
Mhm.
say, again, getting back to what are your family values around how you want to live your life in your family. How important is it for you to be outside in nature? How important is it you to be in community with others and giving them your full attention? How important is it for you to be in person with your extended family members? It's really to talk about this and even share, depending on their age, how these devices have been designed with manipulative features that are trying to capture our attention. I mean, no young person wants to be manipulated or taken advantage of. So I think understanding that as well as understanding the developing brain.
Yeah.
So, just it's really the sharing of as a family of depending on how old your children are, but having conversations about this and ask them
Mhm.
what they're noticing. What are they noticing as they're gaming and as they're asked to stop the game? Like how are they feeling when that happens? Like it really
Yeah.
is to bring it to the forefront and have these ongoing conversations. And then there's some amazing family media plans too. So the Pediatrics, American Academy of Pediatrics has a family media plan. Other
Mm.
websites do too. I can share those with you. And those, depending on the age, like the parents of younger children, they're just probably going to want to craft that for themselves and for their
Mm.
family. As
Mhm.
the young person, as the child gets a little older, you might want to do the family media plan in partnership with your child. What do you
Yeah.
think about family dinners? What do you think about not having our phones when we're driving to soccer practice? What do you think? Just so that, again, that's an opportunity to have a conversation and to decide what's right for our family according to our values and how we want to spend our time and be together with one another.
Is there an assessment that families could use to see if their phone use is too much? Or is it more kind of using like that family media plan or reflecting on values and
Yeah,
kind of
there's
comparing to those things? Or is there like an official thing?
great question. There are several assessment tools. I mentioned the digital flourishing
Mhm.
tool that's from the Digital Wellness Institute. There's another, it's like problematic use assessment that you can take to see, where you are in terms of overuse. Um, I think that one's out of the possibly the University of Connecticut. Anyway,
Gotcha.
there's a number of different assessments that
Yeah.
you can definitely use to raise awareness of your own use as well as, your children.
We're going to have a substantial follow-up email to you all. It sounds like I think Marie's mentioned
Well,
like 50 resources so we will send a whole lot of stuff to you. I want to thank you again, Marie. I have a couple exciting updates and things to share with you all about MPHA, but let's give some applause with like an emoji or however you want to for Marie's time today sharing this with us and all of these resources while I pull up my screen. Okay.
Thanks, everyone. And thank you, Ellen and Mary and MPHA. Really appreciate it and look forward to future conversations.
Yes. Okay, so as I said, you might not have heard it, I'm one of the membership communications co-chairs with MPHA. So I have to say, please, if you're not a member of MPHA, we would love to have you join us. I will put a lot of information in the chat, including our different membership levels. If you are a member of MPHA, thank you so much. It really powers the work we're doing in so many ways. MPHA is a very volunteer-driven organization, like yours truly. We also would encourage you to follow MPHA on our social media platforms. That's a great way to learn about what committees are doing, what upcoming events we have. We have a number of events coming up in September that I want to mention. On September 9th, we're going to have a virtual coffee break for students, start of the school year. And then on the 10th, we're going to have a member walk. It's going to be at Fort Snelling. Enjoy the nice September weather, hopefully. We have our first meeting of our Planetary Health Committee or work group, which is new. I cannot remember that date though, so you're gonna have to look on the website. And then a event on September 20th for members to write letters to voters across the country, encouraging them to vote. If you did not know, the American Public Health Association annual meeting is in Minneapolis this fall. So we will see you there if you're coming. A good opportunity for folks to learn about what we're doing in Minnesota and enjoy Minneapolis. We've created a number of new shirts and sweatshirts in our store. If you want to show your Minnesota Public Health pride at APHA or just in general in your life, I think I just got some. I got a Public Health is My Passion sweatshirt I'm very excited about. That store is open for a limited amount of time. The link is in the chat. And if anyone ever has any questions, feel free to contact us at either membership at mpha.net, admin at mpha.net. And thank you all so much for being here. Have a good rest of your week.